Good evening, everyone. Thank you for being here today. I'm just about to launch my screen, which I hope you can see now. And in the next 2 minutes, we're about to start. So thank you very much for being here. And today's topic is going to be an acne vulgaris. And it's a topic that's actually very close to my heart because it's something that I have experienced with, it's something that I've suffered with, and it's something that I see very much all the time, especially in teenagers. So it's going to be something that's going to be important that we go through. It's going to be great to make sure you have an understanding of this. And hopefully in 2 minutes, we're about to start. So as you're joining, I welcome you guys to, get your cup of teas, get your coffees or whatever you have, sit down and enjoy this because it's going to be a great session. And before I start, just a big thank you to Amy's Pharmacy for giving me this opportunity to be able to present today. Thank you very much for that. And all the patients of ours in our Bicester branch, in our Oxford branch, we really appreciate the support that you've given us. So thank you very much. If it wasn't for the will of God and all your support, we would not be here today. So very much thank you for that from the outset. And we are looking to start in exactly 1 minute's time. And we intend to do this, spend this time together for about 30 to 40 minutes, inshallah, with the will of God. We're going to be together. We're going to be going through this and having this conversation. So if you've got any questions, put it on the YouTube chat. I'm happy to answer it. If I don't answer it then, I'll answer it later on. So do put it through there. Get in touch with me on Facebook. If you've got some questions, definitely you can do that. Get in touch with me on LinkedIn and so on as well. And here we go. Bismillah ar-Rahman ar-Rahim. I'd like to start with the name of God. And thank you very much for being here today. My name is Fahim. I'm your instructor today. Voted Pharmacist of the Year 2019. Was one of the finalists this year as well, alhamdulillah, for an award. So I really appreciate that. And for those of you who voted for me, and we're live on YouTube today. So again, a disclaimer from the outset, folks, that this webinar today, this teaching today essentially is for teaching purposes, okay? If you have any questions or you'd like some medical advice, when I put my medical hat on, you can get in touch with us. So you can get in touch with us at Amy's Pharmacy. You can send me a message on my Facebook, or pop down to the pharmacy, we can have a conversation. That's where I'll have my clinician hat on and we can essentially go through things in a bit more depth. But this is for your knowledge, it's for teaching purposes, for you to get a better understanding of these conditions that we're discussing. So remember that any content that we discuss for teaching purposes, it does not substitute medical advice. So get in touch. So purpose of this webinar or this conversation that we're having is pretty straightforward. It's to explain to all of you exactly what is acne. We hear this term all the time. We've suffered with this term all the time. What is acne? How do you get acne? How do we treat acne? And how do we as clinicians actually manage this for you? And what can you do to look after this? So that's the basic plan. We're going to have a brief introduction about myself. And those of you who are with me on a regular basis, you know about me, you know what I've done, and you know what the vision and the aim is for this. But essentially, these webinars are designed to give patients the knowledge to be able to make decisions about their health. That's essentially what it's about. So just a brief introduction. With the will of God, I qualified as a pharmacist in 2010, went on to set my pharmacy business with the help of my brothers, siblings, my parents, God bless them all. And we set up Amy's Pharmacy in Bicester. And then with the help of the patients there, we went on to set up our second branch, and then I won an award. So it's been absolutely wonderful. So thank you for all your support. But the aim of this webinar is straightforward. What we're going to do, we're going to discuss what is acne. And we shouldn't really use the term acne loosely because actually acne itself means facial eruption. I'm just going to put eruption. Okay, it means facial eruption. And the term that we should use is acne vulgaris. And I'm just going to put VUL, vulgaris, because acne vulgaris is actually making reference to probably the condition that we're talking about this when we go through puberty, when we have these hormones that increase and we go through that change. And we end up getting these, I'm not going to use the medical term like lesion, we'll use the word spots, where you end up getting these spots, right? The term is actually acne vulgaris. Acne means facial eruption, okay? Around the 1800s, I think it was exactly 1830s, 1813s, it came from the Greek term, and the Greek term, acme, A-K-M-E, acme, A-K-M-E. And acme actually meant facial eruption. Vulgaris, which is V-U-L, vulgaris, okay, means common. And the reason why we call it acne vulgaris is because this is that facial eruption of those spots that are common. And when we mean common, we mean we all get them at some point. Well, we think we all get them, or we all normally tend to get them all, around 95% of, unfortunately, teenagers who go to see their primary care physician, their doctor, go see the pharmacist, at some point may get diagnosed with acne. And we're talking about these pimples, these spots that you get, very common. That's what we call acne vulgaris. And you may be like, Fahim, why are you going on about this? Because you may have heard the term rosacea. Have you seen those people or those individuals or that condition where you end up, I shouldn't say people, that condition where you end up getting kind of these veins or these capillaries or whatever medical terms you want to use that start to essentially, come onto the nose. You can get really red cheeks. We also call that acne rosacea. So medical professionals, we like to make sure we're talking about the right facial eruption. And here we're talking about acne vulgaris. So now that that's out of the way, we're also going to discuss how we actually diagnose acne. And it's actually not too difficult, and it's not too different than what you're probably expecting. I'll tell you in a minute how we diagnose this, how you get acne, how we manage acne, and answer any questions that you have. That's basically the plan. So first of all, a bit of knowing about the human body. We need to know just a bit about the human body. And we know what that term, knowing about the human body, is. We call that anatomy. Okay, anatomy. Anatomy is all to do with structure. This is all about we knowing the human body. What is this? What is this? What is this? We must know what it is. We must know what it does. Once we know what it is and what it does, we can then treat it when things go wrong. So we need to look at what happens with acne. In actual fact, we have this region, and we call this the pilosebaceous unit. The pilosebaceous unit. And you might be like, Fahim, what are you talking about? Well, I'll explain to you. The pilosebaceous unit is here, okay? And that includes your hair, okay? So it includes this part of the hair that's going inside here, and we can color this here, okay? It includes your sebaceous gland, and that's this little pouch here. So it includes all of this, and it includes all of this. So we don't just call this the hair, because the hair is the part that you see here. But when we go deep inside, and we also include this structure here. So we have the hair follicle. So that means it's essentially the hair that's going inside. Okay, remember how the hair is. If this is my hair, okay, think of that. The hair fits inside here like this, okay? So it's like a tree, right? So it fits inside something. So it's sat inside something. So this hair sat inside this part, including this area, and I'm going to scribble on this, okay? This area, we call this the pilosebaceous unit. And the problem with acne is going to be there. That's where we have a problem. Something goes wrong in this area. And I want to bring your attention here, okay? And I want you to look at this here, this sebaceous gland, okay? So, first of all, what is a gland? What is a gland? Very straightforward. All a gland is a bunch of cells. I'm going to make it very simple for you. Glands are cells that secrete, I'm just going to put things so we don't get into too much science, that secrete stuff, okay, just to make it easy. And in this case, the sebaceous gland secretes sebum. So sebaceous, I'm going to put S, gland, secretes or releases, if you don't want to use the word secrete, sebum, okay, it releases sebum. Sebum, think of that as this oil. And you might have noticed, some of you might notice that when you like feel part of the face or these areas here, you'll be like, you know what, I've got oily skin. Okay, I've got this oily this T layer. Sometimes we call it the T-zone, or there's certain parts of my face is oily. I've got oily skin. This may have to do with this gland that's releasing this sebum, this oily secretion that it's releasing. So just remember that, okay? The problem with acne is going to be here. We're going to go into this. I'm going to explain to you very basic terms how we actually develop acne. But I just want you to remember from here, we have this area where the hair fits inside to this pocket. And next to this pocket, we have these cells that release this substance or secrete this sebum, this oily substance, okay? And the problem is going to be here. So I hope that makes sense. And I just want you to remember that. And we're now going to go into what happens with acne. Right. Now, what you need to remember, initially what's going to happen, okay, and this is for some reason, the cells here, okay, actually we're going to change our cursor. Let's make it a bit more pointy. Here we go. Okay. Let me point this there for you. Let's change this actually. And that's better. There we go. Okay. So can you make out these cells? I hope you can make this out, and I'll draw these for you. You can see these blobs here. These are cells. Okay, and I'm going to color these in red to make it easy for you. What's happening is that these cells are sticking together. So cells stick. Okay, if you really want to get technical and you want to know what those cells are known as keratinocytes. Doesn't matter. But for now, just remember that the cells that are in that pocket that we spoke about, they start to stick. They're not moving. Okay, normally what happens with our skin, as you know, every so often, around 4 weeks, for example, we lose cells. Okay, every time you do this, okay, like I've rubbed my hand, you are removing cells. These dead cells are falling off. So it makes sense that for cells to always replace the ones that are dead, right? Because we don't want to lose our cover. Imagine this, okay? We don't want to lose this cover. The moment I lose this iPhone cover, now my iPhone has been exposed. So we don't want to do that, okay? But so to ensure that this layer, protective layer stays, every time we lose these cells, and remember this is happening on a level that we can't see without a microscope, unless it's happening so fast that you can see this, like for example, when you have dandruff. It's happening so fast in dandruff that you can actually see those hairs falling or those dead cells falling off. But normally we don't see them. And what's happening here is those cells that are supposed to fall off, they're not falling off. They're sticking together. So that's the first problem, that the cells stick. When that ends up happening, when the cells end up sticking, what will happen next? And we're going to move on to the next stage. So first of all, remember that cells stick. Okay, that's the problem. When that ends up happening, we're going to move here. As the cells start to stick, remember I mentioned to you about this gland or this area that releases this oil? This will start to release oil. Okay, this will start to release oil. It's going to keep releasing more oil because what it does, the whole purpose of releasing this oil is that those cells that normally get wiped off or leave the area, it helps with that process. Think of it, and this is not, don't quote me on this as medically, but remember, think of it as like it's like acts as a cleanser. So it gets released in this region here, and it starts to move the dead cells up, and it removes the dead cells. But what I've explained to you is happening here is the cells are getting stuck. If the cells are getting stuck, this area is becoming narrow. As you can see, it's becoming narrow. Why? Because if the opening was this big, now all of a sudden the cells are growing and they're not moving and they now have nowhere to go and they become narrow. So what's going to happen is this oil can't go anywhere. This oil is now getting stuck because this opening is becoming narrow. Why? Because the cells are sticking. So we can say, now we can write down here that we end up having increased sebum and we start to get a blocked. We're getting a blockage. Blocked. I'm going to call it pore. This pore starts to block. Okay, that's the second stage that's going to happen. Remember, this is very basic. Everything that we discuss is in a lot more depth. But I'm just trying to explain this to you in very basic terms. Okay. Now, one thing I want to highlight is I want you to guess, right? When do you think this oil will start to get produced? What age do you think this starts to happen? And you're hopefully going to guess this. And I'm going to give you 2 seconds to think about it when I draw this out. Right. This oil starts to increase when we go through slightly before puberty, but also during puberty. So I'm going to put down puberty. Okay, puberty. Now you'll understand why you end up getting acne, and it's very much related to puberty, because these cells will become very active as you start to mature as a human. You start to release various different chemicals like testosterone, These are chemicals that are important for your body, and they work and they will start to increase the release of these oils. And now you can imagine what's happening. The cells are sticking together for some reason. We're not going to get into why. There is a reason for this, but we won't get into this why. The cells are sticking together. We also have puberty happening now, and you get this oil starts to increase. The oil can't go anywhere because the opening is closed. So what's going to happen next? Think about it. If you can't go up, you're either going to go this way, or this way. And that's exactly what happens here. So what's happening here now, right, is think about it. You can't go this way. Okay, it's blocked. So what ends up happening is instead you end up going, and we can change the color to, I'm going to try white, and you end up going this way, and you end up expanding this way. Okay, that's what's going to happen. And that is exactly what's happening here, is you're going this direction, and you go this direction. Why? Because you can't make your way upwards. You go this direction. And at the same time, while this is happening, you have a good friend of ours, an acne, or not an acne, rather a bacteria, which becomes involved. Okay, why? You get bacteria. We normally, as you know, we have bacteria all over our bodies, right? And normally bacteria live with us. They don't cause a problem. We have them in our gut, various parts. But sometimes under certain circumstances, they can get a bit excited. And that's what's happening here. The bacteria have become a bit excited. They're realizing, hold on, hey, these cells can't go anywhere. There's all this oil here. We've got something to munch on. We can eat on something. Let's grow. And that's what happens, because they think about it, right? You've put them in this area where you have all this oil, which is food for them. You've got dead cells. And let me give you something very basic. When you're eating chicken, what are you eating? You're eating muscle cells. Okay? When you're having meat, you're having muscle cells. So remember, everything you're having is on a cellular level. You're having cells. And same thing here, they're eating on your cells. That's what they're doing. They're eating on your skin cells. They're thinking, great, these skin cells can't go anywhere. Why don't we have a party? And we have this bacteria known as C. acne. Now, it used to be known as P. acne, but we don't call that anymore. It's now known as C. acne. Okay, I'm not going to go into the full terminology. It's called C. acne. But the C. acne will now start to cause your body to react, because your body now has a bacteria there, and we don't like bacteria being there without our permission. It's growing too fast. Now your body has to react. Okay? So what's happening is you're getting this plug being formed, and we know why we get a plug. I'm just going to pretend here that we got this plug. Okay? You've got this plug that's being formed here. Why? Because nothing can move here. Look how narrow it's gone. Nothing is getting out. You've got a plug. Okay? You've got a plug. What's going to happen after that? As you know, you can only push something so far. When you push it too far, it's got to do something, and what happens is it bursts. And in our next picture, what's happening is, unfortunately, it bursts. And that's where you end up getting, things start to become a bit bad, where you end up getting, it can become painful. You can end up getting pus. That's what's happening here. Okay? So I'm going to explain another point to you before we recap this. A lot of you would have heard of the terms whiteheads, blackheads, open pores, closed pores. Let's first clarify this. What is a whitehead? Whitehead. Okay. All a whitehead is when the pore, so whitehead is, I'll draw this out actually. Whitehead is known as a closed, it's known as a closed comedone. So don't worry about this. Okay, I'll explain to you in a minute. Open, so blackhead. Okay, right. Let me explain this to you first. Okay, so imagine this being the lining of your skin. Okay, here you go. There's your skin. Okay, and here is the opening to the hair. And I'm just going to draw it out just a bit here. We can draw my hair. There you go. There's my hair. It's trying to make its way out. Okay. If you have this plug that's formed here, so you've got this blockage here, you've got this plug that's being formed here, but this plug is open, so you can see it's not fully blocked, it's open. We call that a blackhead. And you might wonder, Fahim, why is it a blackhead? And the reason it's a blackhead is because the air or the oxygen, the air outside, I'm just going to put O2 here. I'm just going to put O2 to make it easier. The oxygen outside will interact with the contents of what's inside here. Okay, that's all I want to say about this. I don't want to confuse it. It's going to interact with this. Okay, and it gives it a black color. That's why we call that a blackhead or open comedor. All a comedor is, you might say, Fahim, what's a comedor? A comedor is, in simple terms, is a very, very, very small spot that isn't becoming red, isn't becoming irritated. It's a very small spot. And I'll explain that in a second. It's a very small spot that isn't red, isn't irritating, but it's blocked up. It's got all this stuff, this oil cells that are blocked up inside. Okay. And when you have these blocked up cells, you have these blocked up oil, we call that a comedor. Okay. And when it's open, and you can have the air that interacts with everything inside, don't worry about how that happens, we call that a blackhead. Now guess what a whitehead is. What do you think is a whitehead? We'll do the same concept here. Let's change the tool. Same concept here. So we've got this now, okay? And now what I'm going to tell you is, look, that opening, let's actually do it a bit closer here. The opening is practically blocked. The opening is blocked. So we're going to redraw this out again to make this understand, because a lot of you will be like, I've heard these terms, what does it mean? Okay, so this is what I'm going to explain this to you now. Same diagram. Okay, there's my lovely hair that has just made it through here. Okay, but you can see that the opening is blocked. When the opening is blocked, okay, we call that a, what do we call that? We call that a whitehead. A whitehead. Why? Because the oxygen that's there, that's in the air, the oxygen cannot interact with the contents inside this region. Why? Because it's closed. Nothing's interacting there. It can't happen. It cannot happen. Okay? And that's why we call that a whitehead or a closed comedor. So I hope that makes sense to you, and I'll explain to you again. Sometimes you'll see patients or you'll see individuals or friends, and you'll see that they'll have these spots. They're not red, but you can see that there's white inside them. And I'll show you pictures in a second. That is a whitehead. Sometimes you look at them and you say, oh, you've got these black block pores. Okay, what are these block pores? You've got these blackheads. Okay, and it's open, so the oxygen or the air can interact with the contents inside that area, and it turns black, and it's called a blackhead. Well, that is important for us because that is what helps us diagnose acne. Why? Because as I explained to you, the cells are getting stuck together. The cells have stuck together. The oil has increased. Cells have stuck together. Oils have increased. Cells stuck together. Oils increased. The plug, we're forming this plug. It can't go anywhere. It's going to break out. And either you're going to get an open area or a closed area, and that's the difference. So I hope that makes sense to you. But this is important for you to understand. So think about it, right? How do we have to treat this? We have to stop these cells from sticking together. Number one. Number two, we have to stop your body from releasing too much of this oil. Another treatment option. Number three, we have to stop bacteria. These are three ways that we treat acne. Now you'll hopefully understand that we have to stop cells from sticking. Don't stick, move on. Two, stop increase in sebum. And three, stop bacteria from, I don't want to use the word partying, but stop bacteria from essentially making things worse for us. And then reduce body response. Because remember, when you have any sort of damage, whether it be you get a hammer, and if I was to hit myself, I don't know why I would do that, but if I was to hit with this iPhone on my wrist, and it's going to be painful, and my body will respond. It's going to cause inflammation. It's going to get hot. It's going to get tender. It's going to get swollen. There's going to be fluid there. Same thing here. You've got bacteria, so your body has to respond. And the problem is that when your body starts to respond with this inflammation, you end up damaging the skin even more. And end up getting scarring. And we'll discuss that in a minute. So I hope that's made sense to you. Let's move on to the next slide. Causes. The biggest cause of acne, unfortunately, is hormonal changes. When your body goes through changes, when you're going through maturity, you're going to release these hormones, and these will act on those cells. You get more of this oil being produced, you get a blockage. Other things that can affect, is external factors. So for example, you may use certain creams or certain products that can irritate the skin. So that can happen as well. Diet itself is the word I want to use is diet is a bit controversial. We haven't been able to find real evidence to say that diet does affect, but a lot of patients will say to you, and I can swear this myself, is that when I used to have certain oily foods or junk food, it did make a difference, but we haven't been able to link it totally yet with what food has to do with that. But I think generally eating healthy can't do you any harm, okay? Stress, is there anything that stress doesn't cause? It's there. Now, one thing I want all of us to remember, and please, 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 please remember this, is if your acne or these spots or these pimples is affecting your mental health, or you're getting bogged down, and it does really affect you, because I know as a teenager, when I went to school, it really does affect your confidence. You must seek help. You must get in touch with someone. Speak to your pharmacist, pop down to us at Amy's, pop down to your local pharmacist, speak with your nurse, speak with your doctor. You need to get help. Why? Because it can really start to affect your mind, and we want you to be healthy. We want you to enjoy life. We don't want you to feel upset. So that's important. So if it starts to affect you mentally, you're feeling upset, you're feeling down, you must get in touch. If you start to get very bad acne, where it's really all over your face, everywhere, it looks bad, you must get in touch. Why? If we don't treat it early, it's going to cause problems later on. If you start to develop scarring, where you look at your skin and you're getting holes, and that's a simple way to put it. So here's your skin, okay? And you realize actually that my skin's now because it's got these tiny holes. I'm starting to get these holes inside. You must seek advice very, very soon. Why? Because otherwise those holes are going to be very, very difficult to treat. And we don't treat them early, and we don't catch those that scarring, those indentation, those pits that form early, treatment is a problem. So you must get in touch. Also, if you're trying treatment and it hasn't worked, it's gone on for more than 8 weeks, 9 weeks, 10 weeks, it's not working, you need to get in touch. Why? Because if we don't treat this and you keep having your body responding to this and making things a bit worse, it's going to be bad for you. Your acne will get worse and you'll be left with, scarring. You must get in touch. So this is the end of part 1. As you know, I like to have a break. Probably I'll count till 5. We'll have a 5-second break, and then we can divide this video into 2 parts, and then we'll go into part 2, and we'll hopefully wrap this video up. So let's have a 5-minute break, and I'll count till 5 in my mind, and then we'll move on. Perfect. And the reason why I do that is so I can edit the video later on. So introduction, acne vulgaris. We can now start to go through this. Acne vulgaris. We know what acne means. We know what vulgaris is. It's common acne. Primarily in adolescence. However, what we're finding is women, as they start to age, tend to be getting this a lot more. We also find that men tend to be affected a lot more, or tend to have more severe acne than women. Areas that we find it: on the face, on the back, chest, shoulders, upper arms, very, very common. Okay, the reason is because remember those hair, those I don't want to use the word pilosebaceous unit, but I'm tempted to. Remember that where you have hair, so wherever you have hair, okay, you're going to have the oil being produced. And that's where those oil producing cells are more common: on the face, on the chest, on the back, on the shoulders, upper arms. That's where a lot of people get this. Some key facts. It's a condition that affects worldwide. It doesn't matter what race you are, doesn't matter what ethnicity you are, doesn't matter what color you are, it does affect everyone. 650 million people are affected by acne worldwide. 95% of patients or teenagers who present to the doctor or pharmacist with acne will probably be diagnosed with acne. So it's quite common. It's a lot of patients will say it's as bad as having diabetes, back pain. It really can affect you, can really affect your state of mind. So it's very important that you do get in touch. It's horrible, put it that way. It's horrible. And let's have a look at some pictures. Right. So now remember earlier on I was going on about these open pores and blocked pores. Have a look here. Can you see this is white? We call that a whitehead. You know why it's a whitehead now, because it's blocked. No oxygen can get inside. But look closely here and you'll notice that you get some openings here. Okay. Also what I want to do is we've got an even better picture. And what we'll do is we'll be a bit naughty and come here. Okay. And here, what we're going to look at is now have a look at these. Can you see these black? These are blackheads. Okay, now you've seen the pictures. You've got those whiteheads, which are closed. So no oxygen can interact. That's why it's white. And you have this area where it's open and it's not dirt. You can't pull this out. If you think that you're going to pick it, please don't do that. You can't pull them out. But by picking them, they're very deep inside. It's because of the way the oxygen is interacting with this open area, they become black. So this is what we commonly see, okay? It can be a bit more trickier when you have a slightly different skin tone. So in this particular individual, it's a bit more tricky to see. But if you look, you can make out these black areas here, okay? And you also notice how oily that skin is. You see how oily that skin is? Again, those oils are producing. So that's how we actually diagnose this. What we're looking for is these blackheads and whiteheads, open comedones, closed comedones. That's what we're looking for. In acne, that's the most important thing that we're looking for. That does this patient have this? Why? Because that's important. That's one of the characteristic features that we're looking for. So I thought I'd show you some pictures. Commonly where we find it is around this mid-face region here. And you'll notice here, then it can go into the back, chest and so on, but that's what we're looking for. So I thought I'd share this with you. Other things that we can find is it can get quite serious, and you can have a look here. Unfortunately, this poor gentleman, you notice that he's got a lot of, the skin tone has become very, very dark. So we call this hyperpigmentation. So you notice how the skin tones become dark. You can notice this looks very angry. So you can see the angry here is very angry here. You notice that as well, okay? And if you look closely, we're seeing some white pus. Okay, we're seeing some white pus there. That's what can start to happen. Also, if you look closely, is you're going to notice some indentations here. There you go. There's some scarring happening. You can see that this particular patient now, his acne is quite worse, and you can really see the scarring. These holes, these pits are being formed. If that's your skin, okay, you might wonder, Fahim, what are you talking about? What's scarring? But look, that's normal skin, right? Nice and straightforward. When you get scarring, you end up getting this. Okay, it's the same thing. But instead, what's happening is you end up getting a bit of an indentation in your skin like this. Okay. That is essentially, that is what's happening there. Okay. And that is what we say what scarring is. Unfortunately, that is what you're getting here. It's all nice and straight. Everything is nice and straight. But here you can see that you can go a bit deeper. You can go a bit deeper, and that's scarring. And that's what makes the whole condition look even worse. When you end up getting scarring, you end up getting this darkening of the skin tone. So it's important that you get this treated properly, but that's what can start to happen. And you can notice that this particular individual, things are quite bad. Here we notice that there's a bit of redness happening here as well. Okay, you might also notice these blackheads. There's some blackheads. We also notice some whiteheads. There's some whiteheads. Okay, you notice some whiteheads there as well. So you can start to see that this particular patient has both, and that's what we're looking for when we're diagnosing it. Pretty straightforward. We're looking for these blackheads, these whiteheads. We're looking for scarring, but this is quite important. Okay. Now you can grade acne. Acne can be graded as mild, moderate, severe, and Leeds University or Leeds itself have developed this scale that we can use, this photometric scale that we can use. Okay, so a lot more depth in this, but I thought I'd share this. But essentially, we actually compare pictures and then we can grade you to see how serious it is. Depending how serious it is, that's how we will treat it. Okay. So now let's go on to the treatment itself. Unfortunately, there is no single best treatment. Okay, there is no single best treatment for acne vulgaris. There's a range of treatments that we have to try. First of all, skin hygiene. You don't need to wash your face more than twice a day. Okay, because if you overwash your face with the wrong products, it can irritate the skin. Also, acne is not caused because of dirty skin, so please don't do that. Twice a day is fine, okay? And use soaps or use various products that do not irritate your skin or don't react with the skin, okay? Get in touch with your pharmacist, have a word with him, ask him what products can I use to make sure that my face does not interact, doesn't get irritated by this. So that's the first thing. Don't overwash your face. Don't use too much strong facial rubs and exfoliants and cleansers on your face. It can irritate your face, okay? And it can make it worse. That's the first thing you can do. Secondly, don't pick the skin. Do not pick. Okay, do not pick skin. If you pick skin, it's going to get more annoyed. And if you keep doing that, you're going to be left with serious scarring, okay? You need to moisturize properly. You need to use a very good moisturizer. Very important to look after your skin. Looking after your skin, make sure that your skin is healthy. It also makes sure that it works properly and you can fight the bad guys. Okay, and again, speak to your pharmacist. There's various great moisturizers you can use and he can go through in depth with that. Sun protective factor. I cannot explain to you enough the importance of the sun and being careful with the sun. When it's raining, whether it's snowing, whether it's cloudy outside, the sun rays penetrate. Just because you don't see them doesn't mean they don't exist, and they damage your skin. They cause aging, and we don't want that. It causes your skin to become saggy. It irritates the skin. You start to lose various different underneath layers that make sure that your skin can react like this. You know, babies, when you pull their cheeks, they recoil back, it goes right back. That's what the sun stops that from happening. It starts to damage that. So look after your skin. Then we have various treatment options. So we can use what we call retinoids or azelaic acid. Now, how these work is very simply, these will stop cells from sticking. Stop cells from sticking. So you know that's important. That's what they do. They stop the cells from sticking. Straightforward, okay? They also reduce inflammation. Okay, they stop your skin from overreacting. Remember I told you your body will have to respond somehow, and that's how your body responds. So they stop that from happening. That's how they work, okay? So when you just have these white heads and these black heads, we can treat this very nicely with this. Now, unfortunately, you have to wait about 8 weeks to see a response to the treatment. I know it's a long time, but unfortunately, before we can see if anything works, it's about 8 weeks. The reason is because it takes that long for the actual spots or the pimples or the lesions to actually really reach their form and for you to know the treatment works, about 8 weeks. So unfortunately, it won't happen faster than 8 weeks. If you're somebody who starts to get something like this now, where actually you don't just have the white heads and black heads, you've got this redness happening. You see this poor girl's face? She's got redness on her, the spots that surround, okay? For this, we have to use other treatments. We have to now give you antibiotics. Why? Because you know there's bacteria there. We've discussed that. Our good friend C. acne, remember? That will work there. So that's where we can treat you with antibiotics, okay? But we want to combine antibiotics. We don't like to give antibiotics alone because of resistance. Antibiotics are now becoming resistant to, or rather bacteria are becoming resistant to antibiotics. So those bad guys are like, oh, you've taken so much amoxicillin that we know exactly how to fight this. So we have to stop that from happening. That's why we like to combine two products together. And these two products will work by, they work on the bacteria and they reduce inflammation. Okay, so we can work there as well. And you can add things. You can add the retinoids to this combination. You can add the azelaic acid. So we can use various different combinations. Now, when things start to get out of hand, which is unfortunately in this case, as you can see, this particular individual, it's gone very severe now. That is where you have to see a specialist, and normally a dermatologist. And the treatment is with this particular medication that is very, very good for those patients who it's supposed to be used for, very helpful, and he will prescribe this for you, but that's when it becomes very bad. And that's where you have to see a specialist, okay? So this is essentially the kind of things that we've discussed here. And this is just a brief overview. We're not going to go into too much depth, but get in touch with your pharmacist. We can have various conversations and go through this in depth and give you a proper treatment plan. But to summarize, 1, acne vulgaris is that condition that causes the pimples, the spots that we get in as teenagers. Number 2, why it happens. cells start to stick together. We have a lot of release of these oils. The oil can't go anywhere. The bacteria start having fun. We end up getting inflammation. So we have to treat this. We have to stop the cells from sticking together. We have to stop these oils from being overproduced. And we need to stop this bacteria from coming there. That's how we treat it. I've just given an option here. Again, salicylic acid. This is an option. For example, we can offer this within various clinics, but you can see that you can use, we can recommend salicylic acid. We can recommend antibiotics, sun protective factor, moisturizer. Then at night, you then again use a cleanser and then use a topical, the retinoid, that cream that I was talking about. So you can see we can have a wonderful regime for you, which you use, which you stick to. And with the will of God, your acne, should you stick with this, it will disappear, okay? Or start to improve. I hope you found this useful. Please do subscribe to my YouTube channel. Continue to watch. Any questions you have, write them there. I'm happy to answer them for you. Thank you for supporting us. Stay safe. Have a wonderful evening, and I will see you next week. Thank you for watching. I will hang around if you've got any questions, but that is all for me today. Thank you for watching. So we have a question: how do inflammatory and non-inflammatory acne differ in appearance? Okay, that's a good question. I like that question. Well, we can demonstrate this. Inflammatory acne, as the term suggests, is here. So thank you for the question. Here's inflammatory acne. You can see that there. You can see that redness. Okay, so someone's asked, how does it differ? That's how it differs. So inflammatory acne is where you end up getting this redness. Okay, I'm going to make it in very basic terms. You end up getting this redness, this irritation. Okay, you end up getting redness. It may become painful, but the key is that we start to notice this redness. And if you have a look on this person, you notice that. If you have a look here, you notice the redness down around the spots. But if you have a look here, we don't get the redness. It's not red. It's just the blockage of the, you get this plug or this sebum that's there. Okay, but when it starts to become red, starts to become irritated, that's what we call inflammatory acne itself. Okay, and I can show you just another picture of this to really clarify this. And here's another example. A great example here is, you notice, there you go, look at that redness right there. Okay, and you're noticing there that there's a bit of pus in there as well. Okay, that's inflammatory now. Okay, again, this particular gentleman, same thing here. But look at these pores. This is a mixture of inflammatory and non-inflammatory. So I hope that's answered your question, Sabat. Thank you for asking, but I hope that's answered your question. That's how do inflammatory, non-inflammatory acne differ in appearance. That's it there for you. So non-inflammatory acne, we're just getting those pores that are blocked. Your body doesn't need to start to become red, hot, tender. We don't get inflammation. But once you start to get this buildup of this pus, this bacteria, and essentially what's going on there, your body will respond. How we see it with the naked eye is you end up getting redness. There'll be white pus there. It may be painful, and it could become like this. That's another example. So M. Sabit, thank you for that question. I really appreciate that. Good question. And I'm going to have to love you and leave you all. Thank you for watching. God bless you all. And if you've got any questions, you write them in the chat. We can discuss it. Many thanks. Stay